بسم الله الرحمن الرحيم. السلام عليكم الطلبة الأعزاء. The next structure we are going to study is the brain blood circulation. Now, one of the main branches or artery that's supplying the brain is the internal carotid artery. You know, it's entered the cranial cavity. It is one of the branches of the common carotid artery in the neck, which its origin is from the subclavian artery. Now, subclavian artery gives the common carotid artery, then the internal common carotid artery divided into internal carotid and external carotid artery. The internal carotid artery takes its way through the internal carotid canal to go inside the cranial cavity, enter the cavernous sinus, and then go lateral to the optic chiasma. Small branches coming out from the internal carotid artery here. One of them, posterior communicating artery. That is the posterior communicating artery. Okay. Joins posterior cerebral artery, which is a branch of the basilar artery. Gives supply to hypophysis cerebri. Hypophysis cerebri is the pituitary gland, the synonymous name of the pituitary gland, and give to the optic tract. That's the pituitary, that's the optic tract, and two crus of midbrain. Of the midbrain, and the two crosses are هما الذراعين اللذين يربطون بين الميدبرين والتو cerebral hemisphere. And give also anterior choroidal artery to the choroid plexus inside the brain. Anterior choroid artery to crus cerebri والchoroid plexus. Crus cerebri also to the crus cerebri. And we said the crus cerebri are the two crosses or الأذرع which connect between the pons and the two cerebral hemisphere. Now, this diagram shows us the two main arteries that enter the cranial cavity and distributed to the different part of the brain. We said that's the internal carotid artery and the two vertebral artery through the foramen magnum, which forming the basilar artery. Now, we mentioned the branches of the internal carotid artery. Look, this part is inside the carotid canal. Okay. Now, inside the carotid canal, when coming from the carotid canal, it's entered to the cavernous sinus. So this diagram shows us the internal carotid artery inside the cavernous sinus. And we are going to describe in detail the cavernous sinus and the structures that are present inside it. Now, here, once it's get out from the cavernous sinus, give ophthalmic artery, that is the ophthalmic artery that gets its way to the orbital cavity, accompanying the optic nerve. And the two hypophyseal arteries, that is the two hypophyseal artery to the pituitary gland. Nice. Then give two important branches, which they are the anterior cerebral artery and posterior communicating artery. That's a posterior communicating artery that join the cerebral artery, posterior cerebral artery. Then the three arteries, which is the anterior cerebral artery and the communicating artery, anterior communicating artery and the posterior communicating artery, with the posterior cerebral artery making circle of wheel, not a circle of wheel. Now, the two vertebral arteries, which are from the subclavian artery, that this diagram shows us the vertebral artery that go through the transverse foramen of the cervical vertebrae. Okay, through the transverse foramen of the cervical vertebrae, with the exception of the 7th cervical vertebrae. and then enter through the foramen magnum to get its way as a forming the two vertebral arteries join each other to forming the basilar artery. Now, the two vertebral artery give one branch, two branches communicate to each other to forming the anterior spinal artery that descend downward anterior to the spinal cord. And the two vertebral artery give posterior inferior cerebellar artery. It means to the cerebellum, inferior surface of the cerebellum. Then, from the basilar artery are the anterior inferior cerebellar artery. Anterior inferior cerebellar artery. Then, the basilar artery give the first branch is the labyrinthine artery. Labyrinthine is meant to the internal ear, to the stroma and the inside the petrous part of the temporal bone to the internal ear through the internal acoustic meatus, and 4 to 5 branches which are pontine arteries, pontine artery, and then superior cerebellar artery. Now look here behind we have anterior inferior cerebellar artery, posterior inferior cerebellar artery, and more anterior the basilar artery give the superior cerebellar artery, superior cerebellar artery, and posterior cerebral artery, posterior cerebral artery that communicate with the anterior carotid artery through the posterior communicating artery. These are the distribution of the blood vessel inside the cranial cavity. Now, the vertebral artery, as we said, from the basilar, forming the basilar artery, and we mentioned the branches that giving from the vertebral arteries, the posterior inferior cerebellar artery, and the anterior inferior cerebellar artery, and the anterior spinal artery, and then the first branch of the basilar artery, which is the labyrinthine artery. Now, remagnification of the basilar artery and its branches and distribution to the bones, to the anterior and posterior perforating substance, and so on. Now, another diagram also showing the branches of the basilar artery inside the cranial cavity. Okay, the same distribution of the branches of the basilar artery and the vertebral artery. Okay, the same we mentioned then. Now, the venous circulation of the brain. Veins are so thin, so invisible, unless filled with blood, because they are confused with the thin membrane, which is the pia mater. Cerebral veins are on the surface of the hemispheres, of the two hemispheres, are on the surface of the hemispheres. Pierce dura and arachnoid to join the venous sinuses. So, what we mean by venous sinuses? We mean the superior sagittal sinus, inferior sagittal sinus, and sigmoid sinus, transverse sinus, superficial middle cerebral sinus, and deep middle cerebral sinus. Now, here we refer to all of the veins that present on the surface of the hemisphere. Now, superior cerebral vein, that is the superior cerebral vein. Here is the superior sagittal sinus, superior sagittal sinus, around the above surface of the hemisphere. Okay, and here is the transverse sinus. Look, the transverse sinus, and inferior anastomosing vein, inferior anastomosing vein. Okay, and superior anastomosing vein, superior anastomosing vein and inferior anastomosing vein. That's the superior anastomosing vein and here is the inferior anastomosing vein. Again, the main veins are the superior sagittal sinus, inferior, not clear here in this diagram, inferior sagittal sinus, okay, the superficial middle cerebral sinus and deep cerebral sinus, and the superior anastomosing vein and inferior anastomosing vein. These are the veins that are distributed on the surface of the sphere. Now, veins from the inferior surface. When we raise the, now this diagram showing the raising, after raising of the brain inside the cranial cavity, anteriorly drain to the deep middle cerebral vein. Okay, anterior drain to the deep middle cerebral vein, which we mention it is a corresponding vein in the deep part of the brain. Now, posteriorly drain into the basal vein, and to the superior petrosal sinus, straight and the transverse sinus. Now, look, here's the cavernous sinus. Okay, join the superior petrosal vein, inferior petrosal vein. The inferior petrosal vein and superior petrosal vein join each other to make forming this transverse sinus. Okay, then join the straight sinus in the confluence of sinuses. Okay, and from here the deep cerebral vein continue. Now, this diagram is a three-dimension diagram of the venous circulation of the brain. No, this is the superior sagittal sinus. Nice. Inferior sagittal sinus. Inferior sagittal sinus. This, the straight go forward to making the inferior sagittal sinus. Then, the internal jugular vein, if we go up, before it is the sigmoid, before it is the transverse sinus, and before it is the confluence of sinuses which connect between the two transverse sinus from two sides, and the superior sagittal sinus and the straight sinus, all of them collected in the where? In the confluence of sinuses at the internal occipital protuberance, and the great cerebral vein that go in the ventricle to supply the choroid plexus or drain blood from the choroid plexus. Then basilic vein, also continuation of the straight sinus, basilic vein that formed by anterior cerebral vein, deep middle cerebral vein, straight vein, and the straight vein descend from substance of the brain through the anterior perforated substance. Higher magnification of the same diagram. Now, for your interest, what is this case? This case is a cavernous sinus thrombosis. It is very dangerous and interesting. So, accordingly, we need to study what is a cavernous sinus thrombosis and how it's occur. Now, look at the face. At the face, here we have the facial vein. The facial vein have communication with the superior ophthalmic vein and inferior ophthalmic vein. Okay, so any defect in this vein or inflammation will transmit it to the cavernous sinus. How it transmitted to the cavernous sinus? Next, we are follow the following to reach the cavernous sinus. Now, what is a cavernous sinus? It is a sinus of vein, a network of vein, or sinuses, network of sinuses of vein, 2 centimeter long, 1 centimeter width, situated where? In the middle cranial fossa on the side of the body of the sphenoid. Anteriorly and superiorly covered by orbital fissure, bounded by orbital fissure, superior orbital fissure. Posteriorly by the apex of the petrous part of the temporal bone. Either anteriorly related to the superior orbital fissure. Posteriorly, the apex of the petrous part of the temporal bone. The floor and medial wall, الأرضية والمedial wall of the cavernous sinus formed by endosteal layer of the dura. Endosteal layer of the dura. Roof and lateral wall formed by meningeal layer of the dura. Okay, now that is the diagram and show us all of these structures that we mentioned that related to the cavernous sinus. Look, that is the cavernous sinus. The floor formed by endosteal of the dura. Laterally also bounded by endosteal layer of the dura. And medially by the pituitary gland or hypophysis cerebri. Okay, look, anteriorly extend into the medial end of the superior orbital fissure. That is the superior orbital fissure. Anteriorly extend to the superior orbital fissure. Posterior to the apex of the petrous part, that is the petrous part of the temporal bone. Medially is the pituitary gland. Laterally, temporal lobe, and separated from each other by the dura. Superiorly, look, the optic chiasma, and the meningeal layer of dura. Inferiorly, endosteal dura, mata, great wing of sphenoid. So under the pituitary gland and under the cavernous sinus is the endosteal dura and the greater wing of sphenoid, or in which the pituitary gland set in the silla torsica. Now, the content of the cavernous sinus, because it is very important, so we concentrate of it and the relations and content of the cavernous sinus. Now, inside the cavernous sinus, two important structures passes inside the cavernous sinus, which are the internal carotid artery and abducent nerve. Internal carotid artery and the abducent nerve. العصب السادس. العصب القحفي السادس. Look, this is the pituitary gland, that is the cavernous sinus, blue in color. Okay. Now, here is the, what is that? That is the sphenoid bone. Okay. Now, on the lateral wall of the cavernous sinus are the following structure. Look, V2, V3, V1, V2, V3. What do we mean by V2, V1, V3? V2, V1, which is the branch of the trigeminal nerve, maxillary. V2 is the mandibular and oculomotor and the trochlear nerve. These four nerves, again, oculomotor, trochlear, abducent inside, while the V1, trigeminal, ophthalmic and mandibular nerve passes in the lateral wall of the cavernous sinus. The structure inside the cavernous sinus are the abducent nerve and the internal carotid artery. Again, another diagram shows the same structure that is present in the lateral wall of the cavernous sinus, oculomotor, trochlear, ophthalmic and maxillary nerve. That is in the lateral wall, okay, between the two layers of pia mater here, while the internal carotid artery and the abducent present inside the cavernous sinus. The pituitary gland set in the silla torsica, and that is the sphenoid sinuses below the silla torsica. This shows us the communication of the cavernous sinus with the other sinuses and veins. Now, in the anterior, more anterior aspect to the central vein of the retina of the eye and superior ophthalmic vein, okay, which go through the supraorbital fissure. Now, from the posterior aspect, communicate with the superior and inferior petrosal sinus. Petrosal, it means to the petrous part of the temporal bone. and the upper margin and lower margin of the petrous part of the temporal bone, while laterally communicate with the middle meningeal sinus. Look, middle meningeal sinus. Then, in the lateral aspect, superficial middle cerebral vein, inferior cerebral vein, superficial middle cerebral vein, inferior cerebral vein, and from the medial aspect, the two sinuses connected to each other by the anterior and posterior intercavernous sinus. Anterior and posterior intercavernous sinus. Now, another diagram also showing the veins that distributed or connected to the cavernous sinus.